Attention all units. House fire, 116 Vermont Avenue. 26, you got a flash over top floor. Flash over. Deputy 1 headquarters, clear all lines. You got a Mayday. One firefighter that's injured right now. Received Deputy 1, we got one firefighter injured. Be advised, EMS is in.
As we were doing a secondary search, the railings at the end of this hallway had been taken down, unknown to me. So as I was following the wall, I literally just, in the dark and the smoke, stepped off at a second floor and fell 12 feet to the first floor. From my injuries, we think my arm got behind me, which crushed all the bones in my hand, and it shattered my elbow. They determined that I would need surgery on my hand and my elbow. They sent me home that evening, and they told me that if I didn't hear from them in a week, that I should call them. And obviously, it doesn't matter whether you're a firefighter or you're just hurt. You want to get back on the road to recovery as soon as possible. From the time of my surgery till the time I was full duty was 1 day short of the 8-week mark. TAHPI was the direct effect of me getting back as fast as I did.
When I worked at Arizona State University and when I worked at the clinic that specialized in Major League Baseball rehab, we needed to know quickly and accurately what was going on with the injured athlete. We would know by Saturday evening, Sunday morning at the latest, what the next step was. There was no downtime, there was no waiting, and the coach would be able to make adjustments as needed. What we started to do is apply the rules of sports medicine to this group of people and individuals because they were experiencing the same time need as to their injured worker, officer, firefighter, getting them back to full duty in the quickest amount of time possible.
The TAHPI program made a lot of sense for us, both from an employee standpoint where they receive benefit and something we could provide our employees, and also from a financial perspective. As a fire department, we're always looking for ways to manage our costs, and we can do that through employee absences and injuries and managing those. You know, people take a job to do that job. When you tell someone they're on light duty or they have an office job when they're used to working outside, it doesn't go over real well. So from a mental health perspective for that employee, they really see the value to it.
We didn't get into this because it was a business idea. We didn't get into this because we were trying to save the city's money. We got into this because we wanted to get people back to their jobs as quickly as possible, to their families as quick as possible, and back to their life as quickly as possible.
I would suggest to anybody, if they have TAHPI, have the resources to use TAHPI, is to use them. And this is from my heart. I would not have been back in 8 weeks if it wasn't for them not only helping and guiding me and help me navigating through the healthcare system. They allowed me and put me in a position to help myself to get back to this end result.